A nursing college in Texas is taking a unique approach to address the critical nursing shortage across the state. Texas A&M University College of Nursing has implemented cutting-edge technology, interprofessional training and simulated learning experiences with the aim of producing the most prepared forensic nurses in the US. Our reporter Harry Horton went along to take a look.
Next thing I know, he just threw me against the table.
That sounds really scary.
It's a distressing but vitally important part of healthcare, assessing a sexual assault victim. The aim? To diagnose any injuries and gather evidence for a potential investigation. This examination looks convincing, but the bruises have been painted on, the victim is actually an actor, and the nurse is in training. It's part of the state-of-the-art simulated learning experience at Texas A&M University College of Nursing. Dr. Stacey Mitchell watches from a nearby room, ready to provide feedback. The college is one of the first to replicate both male and female sexual assault victims, helping to make these simulations as realistic as possible.
We really wanted to make it as realistic as possible so that the new forensic nurse, or the new sexual assault nurse examiner, when they see their first patient, there's no surprises. They're prepared, they understand the different reactions that a patient may have, they understand the length of the exam.
The Texas A&M College of Nursing was recently awarded almost $1.5 million by the US government to help recruit and train nurses from rural and underserved areas in Texas. The training here isn't just about treatment and care, it's also about preventing future sexual violence. And the unique approach to learning has led to the forensic nursing program transitioning to a center of excellence.
I think that recognition puts us on the map, not only as an educational institution with our master's in forensic nursing, our certificate in forensic healthcare, but also in our service and outreach to people across the state. Our faculty and staff are doing tremendous work with educating the people across this vast expanse of this state on topics of human trafficking, sexual assault, prevention of injury, and the list goes on and on.
The college has partnerships with local law enforcement agencies, the Attorney General's office, and community groups to drive improvements in cases related to forensic nursing.
We have been very involved this past year with the legislative session, and we worked very closely with our government liaison and have been available to testify on different bills that may be going through the House or the Senate here in Texas. We've also been consulted by several legislators to, ask our expertise about how should a bill be worded, or what would the downstream effects be if this bill is passed.
Forensic nurses increasingly play a vital role in identifying and helping victims of human trafficking. Clinical Assistant Professor Laurie Charles says the issue is complicated, but the training at Texas A&M is already having a clear impact.
The more education and training we have, the better chance that we can identify it early and maybe prevent further trauma. And then maybe we can actually help these patients change their lives and have positive outcomes. Not all emergency departments have forensic nurses, though. The ones that do, I would argue that the forensic nurses help normal ER doctors and ER nurses understand the signs and symptoms of child abuse, sexual assault, elder abuse, and human trafficking. And just by the nature of having the forensic nurse there, maybe that can help everybody else think forensically.
Forensic nurses are on the front line of treating sexual violence victims. The education and training offered at Texas A&M College of Nursing ensures survivors receive the best possible care and the best chance of justice being served.